We are also incredibly fortunate to work with a wonderful team and a group of professionals across the country at the cystic fibrosis clinics. And we have two of these clinicians who have joined and are giving of their time today to discuss these topics and provide information to the cystic fibrosis community through this session. So I am very pleased to welcome Dr. Christy Wright, who is a registered doctoral psychologist with the University of Regina, Saskatchewan, and also Dr. Ranjani Somayaji, who is an infectious disease specialist and CF physician at the Adult Cystic Fibrosis Clinic in Calgary, Alberta. So welcome, Ranjani, welcome back. You were a panelist in one of our earlier COVID-19 sessions, and Christy, this is your first as far as these sessions are concerned, so we welcome you as well, and thank you again for giving of your time. So this has been a long road with the pandemic, and as I mentioned, we started these sessions over a year ago. We had way more questions than answers, and in some cases we still have some of those same questions now that we're facing. But most of us, I would say, were really naive to the fact that we would still be dealing with this a year and almost a year and a half later, and we certainly have a long way to go before it's behind us. So perhaps we could start, Christy, if I'll ask if you could just provide what you might advise people who are really struggling to cope at this point, because there are just so many continuing unknowns. There's a lot of confusing and negative information out there about where we are with the pandemic. As you're talking to patients and advising them on some of the struggles that they may have, what would you advise to people who are struggling to cope?
Thank you. Thank you for having me. So first of all, I think in general, our knowledge about COVID-19 has grown exponentially. When we're needing information, we obviously need to be relying on reliable sources of information. So that really means that it's our physicians, our CF clinic, and other sources that have been identified as being reliable. And the other thing to think about, and it's hard for people who don't like uncertainty, and in fact, we all have been exposed to this element of uncertainty, is that scientific information is always evolving. So what we knew a year ago is maybe different to what we know today, and we know a lot more. So that's something to always get our head wrapped around, that what was said a few months ago, you may have a different sort of view on it. So again, that's something to think about. But the reality is that uncertainty is a part of life. These type of situations really do put us in a position where we have to grapple with that uncertainty. And some of us are better at grappling with that uncertainty. Some people are a little more what we call intolerant of that uncertainty. Those individuals who are intolerant often are at higher risk for anxiety in general. And so that's like outside of having an illness. So I guess the first part is really relying on reliable sources of information. The next is kind of thinking about whether your concerns are really about that uncertainty. So what to do with that uncertainty. The reality is there's not always a one answer for everyone. So that's one thing. The other thing is that there may be opportunities to sort of challenge those uncertain thoughts. And it can be difficult to do, but it can include sort of asking us different types of questions like, can we always be sure about things in life? Can you cope if, something negative may happen? What is the chance of positive or normal outcomes when you're not sure? So sort of trying to challenge those uncertain thoughts, because we do have them. There are other opportunities that might include sort of just accepting uncertainty, sort of acknowledging those thoughts, and maybe questioning or thinking about, why I might be uncertain this time, not being judgmental about those uncertainties, and then try to focus back here in the now and move forward. So kind of identifying that uncertainty exists, and that there may be ways to address it through challenging or kind of accepting, and then making a plan to move forward. So it is an evolving process and can be a little more difficult for certain people than others.
Thanks very much, Christy. That was very helpful, and some great strategies there. And of course, for people living with cystic fibrosis or other chronic illnesses, they are always having to deal with some of those the uncertainties and the unknowns about their disease. And this has just added a whole other layer of complexity. So I think it's really important to kind of frame this session with some of those strategies that you've just talked about. So thank you for sharing that. One of the reasons why we are where we are in terms of moving forward and perhaps seeing some kind of a light at the end of the tunnel is because of vaccines, of course. And having said that, there are still many questions about vaccines in the CF community and beyond. So Ranjani, I'm sure we have many people participating in this session live, and many more who will be viewing the session once we have posted the recording, who have had the various vaccines that are available in Canada. And of course, the advice, if you go back a few months ago when the vaccine rollout was first started, was the advice from healthcare professionals was, when you have a chance to get the vaccine, get it. Don't necessarily think too much about which one you're getting, but avail yourselves of a vaccine when it becomes available to you. So most of us now are at the point where we're having, or will soon be arranging to have, our second dosing. When we're thinking about second doses now, there are a number of questions. So first one would be, is it okay to mix two different vaccines when going for a second dose?
Okay, great. Thanks again for having me back. That's always nice. So I agree with you that I think, like with everything else, COVID, there are a million questions. So in terms of your question about can we mix vaccines, the simple answer is yes. So I'll give a little bit of an explanation and then end off with yes. And really this largely relates to people that have received the first dose as the AstraZeneca vaccine, which is the one that's available in Canada, in addition to the 2 mRNA vaccines that are available, which are made by Pfizer and Moderna. And I will disclose that I have no shares in any of those companies. And it's better that I use those names versus the BNT6412 or whatever number there is. So for people that have had the AstraZeneca vaccine, now there are studies which have looked at mixing vaccines, so both in the UK as well as a number of other European countries. And they found that actually people who get a second dose as the mRNA vaccine tend to have higher antibody response, so even more or a stronger response with that second dose as the mRNA vaccine versus getting an AstraZeneca dose as the second dose. With that said, if there is somebody that's living outside of Canada that gets the second dose as the AstraZeneca vaccine, that is perfectly okay. I think when we think about what is the risk of clotting, it is quite rare. It's in the range of 1 in 100,000 to 1 in 250,000, so 250,000. So compared to the risk of getting a clot, if somebody actually develops infection with COVID, which is far greater, the risk is still less, and then so gives that protection. Within Canada specifically, and I think most of the audience and probably most of the viewers will be Canadian, the AstraZeneca doses that have come into the country are actually have been kept for first doses. And so really people who have received AstraZeneca will be getting the second dose as one of the other vaccines. So yes, it is perfectly okay. And this isn't new data. And I mean, I think a lot of things relating to COVID are also scarier because they're new and we don't know things about them from before. But I can say with confidence that there's been a lot of different studies in the area of immunology and vaccines where they can look at 2 different mechanisms of types of vaccine, and that, so it's called heterologous vaccine, so just 2 ways that vaccine delivery can happen, and that actually results in a stronger immune response than giving only one type of vaccine twice.
Great, thank you for that. And you've also addressed some of the questions that we had come in around the AstraZeneca vaccine and the safety and efficacy of it as well. So thank you for covering that as well in your response. We appreciate it. We've had some questions, so specific questions. I'm going to read one of them around sort of what's next as we look at once people are fully vaccinated. One of them was, we've been super strict with no indoor visits or physical contact with anyone, including grandparents and our kids. And this particular person does not specify whether their children or one or both of them have cystic fibrosis, but I'm assuming that one or both do. So the question is, how big a risk will it be for our kids to have sleepovers at our grandparents' homes once the grandparents are fully vaccinated? And they add that their kids are 9 and 11, so not vaccinated yet themselves. And also, can vaccinated individuals carry the virus to the kids?
Great. So those are excellent questions. And certainly I think I probably could give an hour-long talk on each of those questions. So I'll try to summarize it in 2 minutes. And again, after this, if there are still remaining questions, I'm happy to send articles if people are interested. I think people living with CF as well as caregivers are like to be informed and are very up on the literature. So I'm happy to do that. So I think, again, a lot of these things come down to the individual, and that alludes a bit to what Dr. Wright said. So we can make general principles, create population level statistics and data, but it really comes down to, what do you think? How risk averse are you? And what makes you anxious or what makes you settled? And so really, I think it will be an individual discussion with that person or family to determine, who feels safe, who feels anxious, because if it's going to stress you out to have your grandkids over, even being vaccinated as the grandparent, say don't do it until you feel better about it. With that said, I think we can look to our neighbors in the South. So the CDC has released updated guidance based on vaccination. And so the general suggestion is that people who are vaccinated and are otherwise considered low risk, so people who haven't had an organ transplant and are on lots of medications that would otherwise compromise the immune system, can essentially return to normal activity. There are a few caveats to that in terms of large crowds, but I don't think most of us are going to jump from seeing only our household to going to a rave tomorrow. So we will have that graduation period even within our own lives. So we can return to normal life. The question about transmission does come up a lot. And so if somebody who's vaccinated, can they still transmit the virus? We are getting more data on that. And so there's a couple of studies from the UK that have demonstrated that people who are vaccinated have lower levels of viruses, even if they are colonized or infected with COVID again. And so if you have lower levels, you're less likely to transmit it than if you're coughing with a high burden of virus. And even in the household of people who had vaccination and got COVID again, there was less likely to be transmission. So it does reduce the risk of transmission after vaccination. So your overall risk is much lower. And then when we think about children, although yes, like if we look at any group of people, some people can get very sick and have complications. In general, children don't tend to get as sick with COVID and don't tend to be hospitalized or have severe outcomes in the same rate as older individuals. So their overall risk is lower. And when we think about CF specifically, the rate of people with CF getting infections with COVID seems to be less than the general population. And that might be largely because of how well or how good they are at doing infection prevention measures like hand hygiene and staying away from sick people in the first place. But it also might relate to the fact that they're not at increased risk than the general population, which is a good thing. And the data that we've seen outside of people who've had lung transplants have shown that they don't tend to get sicker than other people when they do get COVID. So those are all reassuring things. Again, saying that CF doesn't necessarily say make you much higher risk for getting bad outcomes with COVID. So now you're dealing with somebody that has as much risk as the general population, and you have people around you that are vaccinated. So then it really becomes a family discussion to say, hey, we've lowered the risk as much as we can. We're going to still continue to do hand hygiene. We're obviously not going to come over if, I'm coughing more or sneezing. And are we okay with this risk? And I think that many families, that'll be a yes. And especially with the grandparents probably still not going out to many things. And that's another aspect that they can control as a family to say, hey, let's keep our circle still small and let's do this one thing at a time and then see how it goes. And then in terms of the 9 to 11-year-old children, there are studies going on in younger populations for the vaccines. And so the thought is that somewhere between fall 2021, early 2022, the age groups might also be expanded for vaccines to be available. That's
great, very encouraging. And as you were talking about how we can view things as we move into this next phase of the pandemic. It seemed not very long ago that it was so out of reach. Like we were getting to the point where just even getting together with families seemed like something that had become impossible. But it's very encouraging that we're getting to that point where families can make those decisions. To your point, there are always going to be risks involved, and they have to weigh those and make their own decisions. But it's really great to have that perspective and to be encouraged by the fact that people can actually look forward to those kind of activities once again. So thank you for that. We hear a lot about variants, COVID-19 variants as well. And the question is, where are we now in terms of the thinking around variants? What might be coming? Is there any evidence to suggest that the vaccines will or won't be effective against variants? And I understand there's a certain degree of uncertainty around that, but is there anything you can comment on in terms of variants and where we are at this point in time?
Well, I applaud the CF community for asking questions that each can be an hour-long talk. So thank you for that. So variants, and so I mean, just in terms of what is a variant, I'm going to start there. And so COVID is a virus. It's an RNA virus, and so that basically makes it unstable. And viruses, like all human cells, mutate, and because viruses, and specifically COVID, has only one strand of DNA. It doesn't have another partner to base it on. So if there's an error made, it stays. And so it mutates at a very rapid rate. And some mutations stick and some mutations don't. And you think of it as like, for those of you that played video games as a kid, we have like a toolkit, or you equip yourself with a shield and a sword and whatnot. You can only do so many things, or you have like a certain number of points to assign to stamina and speed and strength. You can only assign it so many places. So I think of it, you can think of virus mutations as a toolkit. So if one virus gets a mutation that makes it easier to transmit between people, then it has to give up something else usually. So, because if you were able to transmit really well and killed everybody that you transmitted to, then those people that were dying from it wouldn't be able to spread it to anyone else, and then it would actually end the virus life. So it has to kind of, so only certain mutations stick. So with that said, currently there are a number of variants floating around, and that's to be expected. So a virus mutates, and if it's spreading around in people, it's reproducing in people and making copies of itself, and so it's going to mutate. So the more it's going through populations, the more mutations are going to arise. And again, some of those mutations are going to stick because probably something gives it an ability to transmit easier between people. And so then that's the one that becomes dominant. And so you hear about dominant mutations, dominant circulating strains, and dominant circulating variants. So those are the terms that are used in the news. Currently, all of the variants that are in North America are covered by vaccine to lesser and greater degrees. So the most recent one that's in Canada that we're seeing some cases of, the Delta variant, with one dose of the mRNA vaccines, UK study suggested that the protection level was in the range of 33%, but once people got the second dose, it was in the range of 90%. And so currently, I think all vaccines, or the vaccines that we're getting, protect us from the variants. Is it possible that one day there might be a variant that we need a new type of vaccine? Yes, but the vaccine platforms that have been developed can change the spike protein around, because that is where the mutations mainly happen eventually, so that in 5 years from now, if we need a booster for a different type of variant of COVID that happens to be floating around seasonally, then we have the technology and capacity and platforms to do that.
Thank you for addressing that question in a way that we can understand, and something that's very complex in a nice, concise answer. We appreciate that. And to your point, we've had some really good questions coming in from the community, as we have throughout this entire series of Q&A sessions. And I want to thank everybody for submitting questions. If you've just joined us, welcome, and please do submit. If you have additional questions, you're more than welcome to submit them through the chat feature here in Zoom. and we'll do our best to cover as many questions as we can during the session today. I also want to take this opportunity to thank the donors that make this type of session possible for us and everything we do at Cystic Fibrosis Canada possible. We really do appreciate that support, and I know everyone in the CF community appreciates the support as well. I also forgot to read my little disclaimer at the beginning of these questions that these sessions are not intended to provide medical advice or specific medical advice. So please consult with your CF clinic, your physician, and your clinic team with questions regarding your own personal healthcare circumstances. So we may allude to some specific questions here, but for specific medical advice, of course, always consult with your own physician and clinic team in your community. So I'm going to shift a little bit. We'll come back. We have some other vaccine questions. We had lots of them coming in, so I'll come back with a few of those a bit later. But as many have said throughout the past year, COVID-19 and social distancing and the protocols we're all living right now with hand washing and so on have given people outside of the CF community a bit of a glimpse into what it's like to live with cystic fibrosis and have to adhere to infection control practices all the time. So CF, of course, in many ways can be a very isolating disease. So Christy, I'm wondering if you can maybe share with us how you have helped your patients address the heightened feeling of isolation during the pandemic. And again, particularly for those living with cystic fibrosis who already have a sense of isolation because of their disease.
Sure, good question. One thing that's interesting, talking to some of my colleagues, so I should point out that I'm not directly at the any CF clinic. So I provide care to children with chronic illnesses and also do research in the area and connected with the clinics, but I'm not a psychologist with either of the clinics. But in connection with my collaborators and clinicians, physicians, at least at the Saskatoon clinic, we've had anecdotal reports that the isolation in some cases hasn't felt that extreme, because patients were used to utilizing those precautions. So that's sort of an interesting thing to think about. And anecdotally, I have talked to individuals as well and said that. However, that said, the isolation has been felt, particularly, across all age groups, but with our children and adolescents, particularly adolescents who really spend a significant time with their peers. And so it certainly has been felt. I mean, we also have to think about that not everyone feels the same amount of impact, negative impact from this experience. That said, it's really important, and I think parents have been doing this, but thinking about, or if they haven't, but thinking about how to keep those youth connected, and how do you do that in a way that the youth will buy into it, or the child will buy into it. Some children across the country have been online, doing lots of online learning. And so it's then difficult to have to switch to online play as well. So that said, it's really important to continue those lines of communication, like open them up. And my thoughts are really making sure that they are consistently scheduled, so that children know. Children do really well in when things are predictable for them. They thrive in that consistency. So making sure that those times in which there's social connection are consistent. And so, of course, I'm talking about virtual. As we're going forward, though, there may be opportunity, using appropriate precautions, to have some in-person outside contact, right? In people you feel comfortable with, just that, like has been discussed, people that are following the appropriate precautions. But again, in a planned way. So scheduled activities, varied activities, being creative and having youth or children kind of engage with you to plan types of interactions. But the main thing is to make sure that is identified as important for those kids, and that we value that their interaction is important with others, and have them help direct that. So, parents just picking stuff for kids to do isn't always that fun. When they're little, we can do that and they sort of buy into it, but as they age, that changes. So we want it to be meaningful for those youth. And for, when you think about adults as well, needing to be on top of that. When we delve into more significant psychopathology that could be depression or anxiety, isolation may be one of those symptoms of those illnesses getting more severe. And so we're more apt to isolate ourselves. So being aware if we tend to isolate ourselves, and making sure we kind of try to put ourselves out there, whether it's virtual, via phone, and as things open up in person with precautions will be really important.
Right, thank you. You've alluded to activities happening online. Schooling, of course, is one of those. And so this has been an area of concern for many parents and children and adolescents, even university students who are now beginning, in some cases, beginning their post-secondary education in an online environment. And it's certainly taken a toll on people, parents, students alike, teachers. My wife is a teacher. I'm very well versed on the impacts of the pandemic on people working in the education system as well. But now parents are being faced with having to make decisions about what's next. And in some cases, and we've had some questions from parents who are very anxious about sending their children back to school in the fall. In some cases, they have to make decisions now about whether they want their child to be enrolled in online learning or an in-person or hybrid, depending on the situation, environment, looking towards the fall. So knowing that, what would your advice be in terms of how parents approach that and what seems to be a very, very difficult decision to make at this point in time, considering there are still so many unknowns about where we might be in the fall?
Absolutely. I'm going to share my screen because I feel like I have a number of things that I'm going to itemize that might be maybe helpful, but
sure.
But so I guess I'm going to reiterate what I've said before, but there is no right answer for everyone, right? So it's going to depend on the progression of illness. It's going to depend on your level of comfortability, etc. So consulting is really important, relying on those reliable pieces of information, and supporting yourself. And so I'm going to come back to this, but when I think about this first is that we need to realize that the schools are prepared for our kids to go back. So there are precautions put in place. So we've had, some of us haven't had our kids in school and some of us have had kids back and forth, right? So, but just be aware that schools have to adhere to certain precautions in general. So those will be put in place. So that's sort of information that we'll be aware of. The other thing, and this is on the kids' side, not necessarily on your side, is that we can't assume that children are worried. You know, there's lots of kids that are just going to be super excited to get back. And I've seen that back and forth. So that's one thing. So we don't want to assume that. The other thing that's really important for kids is that we as parents, we model calm. So even if we are struggling with this process and all those unknowns, and maybe for us in particular might be a struggle, that we want to be modeling confidence for our kids. And so it's not that we want to certainly address their concerns, because some kids may have concerns, but we want to not introduce worries, like you'll be worried about this, what will you do? But unless they brought it up, but kind of communicate that they are able to engage in the classroom, they're engaging with their friends. And one of the ways to do that will be sort of preparing them to go back to school. So this is also something that I work with parents when they have anxious kids in general, and even just kids that are starting school, is let's go to school and try it out. Let's go on the playground. Let's practice the bus route. Let's do those things so that the children have a template in their head about what to expect. What are they going to do on the playground? What are they going to at lunch? What do you think your teacher's going to do? So giving some ideas about the exciting pieces of going back to school, and then getting them kind of excited. Now, that doesn't necessarily address mums and dads' concerns, but again, relying on reliable pieces of information, identifying that uncertainty and seeing if there's ways to challenge that. And that may be on your own, but also maybe seeking out services for yourself. If this is really something that's bothering you and you're struggling to maybe not model that calm, maybe seeking out psychological resources to support your sort of that communication to your child that they're okay to go. But again, you're going to have to make that decision based on all those pieces of information if it's going to fit for you and your family.
Great, thank you. That's very helpful. Thank you for preparing that and for sharing this information with us. When you're talking about some of those strategies, it almost reminds me of preparing to go to school for the first time. It's like we're starting all over again. It's been that long, and with these added concerns. So I think those are some very helpful perspectives for parents and students alike. I'm going to shift back to a few vaccine-related questions now. We've had a few questions from people who are post-transplant, and one of them is whether once someone, if there's the milestone of having a second dose, if that is a signal in terms of a milestone around people who are post-transplant being able to ease up on some of the protocols around social distancing and returning to work and school and that sort of thing. Is that something that you might be able to comment on, perhaps Ranjani?
Sure, I can comment on all sorts of things. Yeah, so that's a really good question, and it's probably one area in the vaccine area of COVID that we have less information about. So there's been a couple of studies done where they looked at people who had an organ transplant, and found that people on average after 2 doses of vaccine had in the range of 50%, like 50% of them had antibodies in the blood. And even that level of antibodies, and again, these antibody measures and assays that we use for blood testing aren't perfect. So they don't give it as an exact immunity value. And I think the other caveat is that we don't really know what to compare it to, right? Because the ideal comparison, if you think about it, is to have people that don't have transplant and follow them forward and to see who actually develops infection, right? And we don't have that key piece of information. So even if this value is less than someone without a transplant, we don't really know what that really means in real life. And so that's a huge caveat to all these studies. But with that said, it was about 50% where they actually measured antibodies in the blood, and that level was lower. So what does that mean? So it suggests that people who've had lung transplant tend to mount a lesser antibody response to these vaccines than people without lung transplant. And then within that lung transplant category, and this applies to other organ transplant, using lung as the example because it's more common in CF. And within that transplant category, people who are on certain immunosuppressive agents, and so a common one that might be used is mycophenolate, azathioprine, that can be used post-lung transplant. And so that those people that are on those medications, the levels tend to be even lower. And so there is work going on to see if people who've had transplant should get another booster shot, so a third one, or maybe even serial booster shots. There isn't enough data to make that as a recommendation yet, so nobody's actually recommended that. And so with that said, I think the general recommendation is that for people who've had transplants, they probably can't go fully back to life like CDC has recommended for people that aren't immunosuppressed. But I think that, but I think there's another couple of caveats to that, is that the blood test that we use to measure antibodies is only one type of immunity that we're measuring. So there are other ways to measure immunity, and there are other types of immunity. So if I had a lung transplant, I get vaccine, even if I don't have measurable antibodies in my blood, if I were to be encountered with COVID infection again, there are other arms of my immune system that could still prevent me from getting sick at all, or very sick. And those, again, are things that we don't really know. And part of that, unfortunately, will be time where we look at the people that have gotten transplanted and get vaccine and see what happens, which, isn't ideal. But I think, for people who've had transplant and they're thinking about, can I ease restrictions? I think probably you can ease a little bit, but again, it depends on that individual discussion with ideally your transplant team, or at least the CF team, to say, this is my situation, these are the medications I'm on, this is the person I would be seeing. And probably I would encourage that if you are going to be socializing with anyone, that it would be people that have also been completely vaccinated, to, again, diminish the risk from that side of things. And then the other thing in terms of socializing, I would encourage outdoor activities, right? Outdoor activities have much less risk for transmission of COVID in the first place. So I think if you're going to see your family member, I think seeing them in an outdoor setting is a good idea. And so I think for the next little while, probably some of the same suggestions would apply in terms of masking in indoor spaces, good hand hygiene, social distancing, and hopefully we will get some more data on another booster and better and kind of improved guidance and updated guidance for people who've had transplant. And I think, overall, as people get vaccinated in the community and we're seeing lesser cases, that still overall diminishes the risk for both people who have and haven't had transplant.
Yeah, no, it's definitely an area of concern, and we've had a number of questions come in from people who are post-transplant. So thank you for sharing that. It kind of opens the door to another line of questions we had, and that is around the whole concept of herd immunity and what that really means. We hear a lot about it, and there are a lot of questions about what is herd immunity, and how many people need to be vaccinated in order for us to achieve this, and will it ever actually happen?
Yeah, good question. I mean, I think so. It depends on each country, and so I think the words "it depends" can be said for almost all of these questions. So you'll notice the theme. So the numbers that have been touted for herd immunity are about 50 to 80%. And really, if we think of the whole world of people as a herd, so if enough of the herd get vaccinated and are thus protected from infection, they then act as a herd to protect, you know, the children, for example, and the other people that either can't or have not received vaccine, is effectively what herd immunity means. And so you can imagine that, you know, if there's 4 of us that are panelists that you can see pictures of, and so if I said, you know what, I don't want to get a vaccine, and Jeff, Dr. Wright, and Ian went on and got vaccine and said, hey, we feel bad for Ranjini, we'll protect her as the herd. So by forming a cocoon around me, they're effectively protecting me from any viruses bouncing around us, is what herd immunity is meant to be. And so I think it can work to a large degree. And so I think once enough of the population are vaccinated, I think we will achieve some degree of herd immunity. With that said, there are some more recent studies and visualizations that have said, you know, even with that herd immunity, so even with a significant proportion of the population being vaccinated, I think it's still important to continue with some of the behavioral interventions and ease them slowly. And again, a lot of those behavioral interventions can even be common sense things. So if we think about hand hygiene, I think no matter what, because of the social media and everything else, people are more aware to wash their hands more often when they do things, touch things, get their hands dirty. I think even social distancing probably is a behavioral intervention that can have an effect. And then masking to a degree, especially in tight indoor spaces and where there isn't adequate ventilation, which is probably less of a concern in Canada, but I think in many parts of the world, there's inadequate ventilation in many buildings. So I think it'll be a combination of vaccination and then all the common sense behaviors that we can employ, and including not going to work when sick or not going to other people's houses when you're obviously sick.
Yeah, I think to a certain extent, we'll never go back to quote unquote the way things were in some aspects, and this could be one of the positives, if you will, coming out of this pandemic, is that people are much more in tune with hand hygiene and with what to do when you're not feeling well, and I think those kind of behaviors will continue, and that'll certainly help to move things along as well. Thank you. Christy, what we're seeing still in some cases, vaccine hesitancy among certain people in the population. And I know that we've done everything we can, I think, to encourage people to follow the advice of healthcare professionals and to believe in the science and to have faith in the efficacy and the safety of vaccines. But around that whole concept of vaccine hesitancy, do you have any thoughts around how people might deal with that if it's something that they or someone close to them might be struggling with?
Well, there's going to be a percentage of our population that are not going to go ahead with it, right? We see that with vaccinations in general. So I think that we will have to just come to grips with that's the way it's going to be. In terms of those people that are on the fence that aren't sure are back in that uncertainty world, right? So again, if they're aware of their uncertainty and aware of that's maybe directing their hesitancy, I think that that's helpful, having insight about that. And if it does, then you can move to those steps of maybe finding ways to challenge that uncertainty that might move you ahead to making those decisions. I think without that insight about your uncertainty and how it directs your behavior, I'm not sure there's going to be a lot of movement. So it just leaves the rest of us kind of exposed to their decisions, I guess. It's a really hard thing to move people on, we do have a population that, it's good to ask questions. That's absolutely, I mean, we're scientists, we want to ask questions. When we move forward to answer those questions or figure out ways to answer those questions, I think that's the most productive way. But there are other people certainly that just ask questions and aren't able to sort of have the resources to interpret data coming in, and so can't make those informed decisions or decide not to make those informed decisions based on the science. And those people will continue to exist.
Shifting gears a little bit here in terms of children and vaccinations, there are some questions that have come in around, first of all, around potential side effects and what's happening, what the thinking is around that, and particularly children with CF, obviously, but also what's happening around clinical trials for vaccines on children that are younger, and what do you expect to happen around that?
Sure. So I think, as I mentioned in an earlier question, Jeff, there are ongoing clinical trials for children under 12. And so phase 1, 2, 3. And so they're kind of doing them. Normally phase 1 would happen first, then 2, then 3. But just given that we're in a pandemic, things happen at a more rapid pace, and as they should. And generally with vaccines and really most drugs that can technically treat the whole population, they're tested out in adults first, then younger and younger age groups. And so that is a typical process. And so they are being tested. And so different news articles have suggested that either as early as fall 2021 or maybe as late as early 2022, they would be available for children under 12. And so, yeah, so it'll be the Pfizer and Moderna vaccines for sure that are being tested right now that I know of.
Great, thank you.
Sorry, and I think you mentioned side effects. I was trying to remember the other part of the question.
Yeah, that was the other
so yeah, I think overall the vaccines are more reactogenic, and I'm just going to share my screen here just to show a couple of images here. So can you see that?
Yes, we can.
Okay, perfect. So this is basically showing efficacy and safety, and so how good they are overall, and by the 4 brands or 4 vaccine manufacturers that were at some point here in Canada. And so as you can see, the Pfizer and Moderna, we've seen overall they're 94-95% effective. AstraZeneca and Janssen or Johnson & Johnson are in the 60 to 70% range. And then on the horizontal axis there, it's how often did someone have a vaccine reaction? And so you can see that they're all in that 50 to 60% range. And then in the second box there, when you look at it by age, so younger people versus older people. So the younger people tend to react more often than people that are older, and that can just be related to immune systems. And so they do tend to be reactogenic, and that it comes to the fact that this virus is entirely new in humans. We've not encountered anything like it before, so we have no pre-existing immunity. So we're all going to react much more so than if it was something like influenza, where we've at least seen a piece of influenza before, or had influenza before, or had a vaccine to influenza. So there'll be some flag that raises by our immune system that says, hey, I've seen something, I've seen your cousin, let me, kill you. And so, second cousin? I don't know. And even so when we think about even infections with COVID in young people, so even when people don't get overtly very sick, when we've imaged them, and this is from early data in Wuhan and other countries, when they did imaging studies, they saw that there was still inflammation on the inside. And so I think that's why it's really important to get vaccine, because even if the vaccine isn't 100% effective, you at least have some then familiarity to it, so that even if you encounter COVID, you're less likely to get very sick. And even if you do get sick, probably overall the inflammation amount will be less. And so the vaccines are going to be reactogenic, but overall they're very safe. And so when I say reactogenic, I think there's been 22 million doses given in Canada, about, or nearly 23 million, and there's about 6,000 reactions that have been reported to the vaccine adverse event reporting system, which is a system of surveillance that's everywhere and that's critical for understanding new drugs and vaccines. And when I say 6,000, it sounds kind of like a lot, but about 1,000 of them are just vaccine site pain. So there's been only about 1,200 serious reactions, and even serious relates to things like lymph node swelling and anything else that's a bit more than, you know, a little bit of pain and achiness. In terms of children, again, safe, and so we're not seeing a lot of major adverse effects, especially with the Pfizer and Moderna. I think we've talked about the clotting risk with AstraZeneca, and there's been about 44 cases of that in Canada. And there is, if you look at the news articles, there's been cases and reports of myocarditis and pericarditis. So itis just means inflammation. And so it's inflammation around the lining of the heart and the muscle of the heart. Again, those are being investigated right now. And I think that's important to do, to take everything seriously. But so far, and this is really outside of Canada, that there's been more cases, and so far it doesn't seem like it is over and above the norm. It does seem to be in younger people, males more so than females. And so when we think about myocarditis and pericarditis, they can actually happen related to viral infections, and they do occur in young people, and they do occur more in males than females generally. And so it's easy to get some of these news reports blown out of proportion, where it says, oh my God, this person got myocarditis 2 days after the vaccine. The vaccine's terrible. Again, I agree that I think it's critical to investigate it because these are new vaccines. But on the flip side, it's also important to ask how often does myocarditis and pericarditis happen outside of the vaccine? And so there is a baseline population rate, and it doesn't seem to be superseding that right now. So so far, it doesn't seem like it's causing more cases than we would expect in the general population, even if the COVID vaccine were not present.
That's great, and it's very encouraging to see the younger people having access to vaccines in the very near future as well.
Mm-hmm.
You may have noticed on your screen the name Hillary Power, who's joined us as well for today's session. Hillary is a student working with Dr. Wright, and Dr. Wright, perhaps you could just introduce Hillary and maybe comment a bit on the research that you're doing together.
Absolutely. So Hillary, I don't know if you want to do a wave. Did you want to show yourself? There she is. Hi. So I have two students, and I don't think Shelby is here, but I have two students that are working in the area of cystic fibrosis, in particular in terms of mental health. What we have done, along with our team members, have created or are in the process of creating sort of a mental health prevention program for children and adolescents and siblings with CF and their siblings. I'm just going to share my screen actually, and I'm just going to show you a screenshot of the program where it's at right now, and it will be accessible. We're sort of in the stages of finalizing this version, but just hold tight for one moment. Of course, it's hiding from me now. There we go. So the program is called ICF Power. So the Internet Delivers Cystic Fibrosis Mental Health Prevention, Wellness, and Resource Program. And it is, and you'll see these two characters that are here, and they're not really characters, they're actually based on two of our CF kids in the country who contributed very meaningfully to the program and their experiences and their views on certain aspects. The program was informed by research by Hillary and Shelby, in terms of what children with CF, what parents of children with CF, healthcare providers, as well as siblings, what they want to know about CF, what impacts them in terms of their emotions as it applies to CF, and then wanting to learn strategies about what to do with these emotions. So all this information, and then from our lovely participants have contributed to this program. And so we are at the stage at which it'll be finalized, and then we'll move on to evaluation, and then at some point, hopefully integration in children and adolescents as we go forward, and siblings will have access to the program via their clinics across the country. So that's one thing that we're doing and very excited. Also, Hillary has been involved with another project. I don't know if Hillary, did you want to mention it briefly?
Sure, yeah. Another project we've been working on is with parents living with CF. It's kind of very new right now. The first thing that we kind of teamed up with the Adult Cystic Fibrosis Advisory Committee to work on, and just to provide different educational resources to parents living with CF and in parenting and how to manage their chronic illness while also navigating those parenting roles. And then we're starting to develop some kind of research around that right now, given that there aren't a lot of studies in general, but mainly in Canada, related to mental health of parents with CF. So we know kind of a little bit about children and adolescents and young adults, but what about now that parents or adults with CF are moving into that parenting role? What do we know about them and their mental health and their needs? So that's kind of the direction it's going.
Great, thank you both for sharing this information and for the great work that you're doing on both these projects. They're very much needed in terms of resources, and we look forward to their continued development and Cystic Fibrosis Canada's involvement in that as well. So thank you for joining us, Hillary, and for sharing that bit about your work as well. We're coming up against the hour here, the clock. We've only got about 5 minutes left, so I do have a couple more questions that I want to try to sneak in before we close off. And these are more sort of forward-looking questions as we think about the future and what might lie ahead for us. So one of them, interesting question that came in from someone, this person is in Ontario, but I think it probably could be somebody from any other province as well, but they were commenting on how when the prioritization was done around vaccine rollouts, that it seemed to be more centered on those who were greater exposure risk, as opposed to those that might be at greater risk of illness or death from COVID. So people who are vulnerable, perhaps in this person's opinion at least, were ignored or neglected as the prioritization was done. So first of all, do you share that view? And if so, what might be done, or what perhaps is being done to ensure that this sort of thing doesn't happen again, and the prioritization is maybe done differently if and when there's another, God forbid, pandemic or another health crisis going forward of this nature?
Yeah, I mean, it's an interesting and ethically charged question. I think, all models are wrong, and some models are more wrong than others. So models for vaccine prioritization are based on death generally, or have been at least based on the order of implementation. And so I think there's also the difference, I think, of perceived risk and actual risk based on data. And so I think, people, whether it's with cystic fibrosis or other chronic illnesses, may perceive themselves, and rightly so, to be at more risk of an outcome. But, for example, using the CF data largely and based on the CF data on those living with CF that have gone on to get COVID infections, we haven't seen that greater risk than the general population, largely, again, with the exception a little bit of people who've had transplant. And so if it's based on perception, yes, it would seem much more unfair. And so based on death, people that are much older age tend to be at much greater risk of death. And so I think that's why older people were prioritized for vaccine, at least in Canada and perhaps many other places too. But again, one could argue that it's not just death, it's morbidity and disability and other long COVID type symptoms that also matter more than death itself. And are we crippling a society by not vaccinating the young adults or the young and middle-aged people first? And so I think, again, I don't think there's a right answer to this. And I think no matter who's vaccinated first, other people will be upset and angry. And I think everybody prioritizes themselves and to their families, as we should. That's our role, right? We take care of our loved ones. And so I think, I would encourage people to continue to advocate for themselves and their communities and their friends and all that. And I think on a positive note, we have ramped up vaccine greatly in Canada. We were lagging behind a lot, and now we have, gone up a lot. And I think it's in the range of 60% or more, depending on the province that you look at, that have received at least one dose. And so that's in that herd immunity range. And again, I think there's a lot of things that have happened in the year and a half that we can be angry and frustrated about, but it's probably better to say, okay, here's where we are now. How do we make it better, and how do we make things better for ourselves moving forward?
Thank you very much. And as someone just pointed out in the chat, that was a very eloquent answer to a very difficult question, and certainly one that doesn't have a clear right or wrong answer. There's a lot of ethical considerations there, as well as scientific data considerations. So thank you for responding to that difficult question. We have just time for just one more, and it's really looking forward again in terms of what's next. And I know some of this is difficult or impossible to predict, but I think some people are concerned around, what's next. Once we have COVID under control, is there going to be another pandemic right up, behind it and forcing us back into this sort of situation? How concerned should we be about the next crisis? And is there any way for us to be better prepared, I guess, going forward?
Dr. Wright, would you like to say anything on it, or?
What I would just say is I hope we're planned. I mean, this is one of the things we have been exposed to a life-changing experience, right? And so we've learned a lot at this point. So I hope what we can do is garner that knowledge and harness it going forward and make some different decisions globally. I guess that's what I think.
Yeah, I mean, I think, from a scientific part of it, in terms of as an infectious disease physician, the boring answer would be that I think a lot of what we're predicting for the future and like what's next, at least in the next phase of COVID, or is it going to go away, and those sorts of questions, a lot of lessons that we're sort of applying to COVID relate to the 1918 pandemic, the Spanish flu, and other flus that have happened, really largely influenza. And saying, okay, that went away after this many years, or it stayed in a different way. And so we have influenza that occurs seasonally. And so that is one of the predictions, that COVID is going to end up being a seasonal virus that's going to come and go, and some people are going to get sick with it. Again, remember that influenza infects tens of millions of people every year, and there's in the range of 500,000 to 1 million deaths every year, right? And we breeze through that season every year without really thinking much about it. And so it might end up being like that. Again, influenza is a different type of virus than a coronavirus. And so there is talk that in the late 1800s, there was a Russian flu that was thought to be caused by one of the coronaviruses that's circulating today. And so that because that was before we actually sequence viruses and did that stuff, we don't really know the exact impact of that and how long it stuck around and the waves that it caused and stuff like that. But it is one of the viruses floating around today. And so there's 4 coronaviruses outside of COVID, of which 3 of them cause seasonal colds and stuff in children, and pretty mild. So maybe it'll turn out to be like that. We really don't know. I think in a generalistic sense, I think, continue the things that we're doing. Let's support each other. Let's stay positive. In terms of concerns, I think we can be concerned about nothing or everything. And so there's always things to be concerned about. I mean, when I go on a hike, I'm concerned about if the bears are going to eat me. So, I make joke of it, but I think there's always things to be concerned about. So I think it's about saying, this is what our life is. Let's learn from it. Let's make the best of it. And let's make each day positive, and let's spend it with our loved ones in a way that we can all be safe and enjoy it. And I think focusing on quality of life as well would be sort of my general message to that.
And that is the perfect way to close off our discussion today. We are out of time, but I wanted to take this opportunity to thank both of you, Drs. Wright and Samayaji, for joining us. We really appreciate you sharing your time and your expertise and the preparation that you put into this as well. We know that this will be a helpful resource, not only for those that have joined us live, but once we post the recording, which will be done very shortly, for people this week and going forward into the future to be able to refer to. So thank you very much for that. Thanks for all the wonderful work that you do on behalf of the entire cystic fibrosis community and Cystic Fibrosis Canada.